This video was filmed at the end of July 2024, and you will see some edits because it wasn't possible to film it all in one sitting. Additionally, between living on a noisy street, unpredictable weather, and there being a lot of background noise from kids playing on the street, passing cars, and a very loud air conditioner unit, I'm using a microphone, and I actually have notes in front of me on the screen you will see me look at. Additionally, it is very difficult for me to sit in one position for more than a few minutes without discomfort and the pain getting a bit unmanageable. My name is Ken, and I'm from a small town north of Chicago known as Mundelein. As you watch this video, I ask you to be patient, as it is very difficult for me to ask for help. I'm the type of person who always tries to help others. It doesn't matter if it's family, friends, or even strangers. If I have the ability, I'm going to do whatever I possibly can. However, asking for help for myself is incredibly challenging and one of the most difficult things I have done. Nonetheless, I'm left with no other options. I have been diagnosed with a rare medical condition known as lymphedema, which has compromised my lymphatic system and led to painful, severe, localized, persistent swelling in my abdomen, upper pubic area, and both of my legs. The swelling is caused by a blockage in the lymphatic system, forcing buildup of lymph fluid in the soft tissues beneath my skin. At this time, doctors estimate I have between 125 and 200 pounds of fluid trapped in my soft tissue. Lymphedema, also known as lymphatic edema or elephantitis in later stages, is caused by a blockage or damage to the lymphatic system that runs in your body parallel to the blood vessels. It's an important part of our immune system, and it fights against infections. What caused my lymphedema? I suffer from secondary lymphedema, a condition resulting in damage to the lymphatic system due to significant trauma or surgery. Approximately 2 decades ago, I had Roux-en-Y gastric bypass, weight loss surgery. Although the procedure was successful, I was not informed that this could be a potential complication. As many individuals experience secondary lymphedema, the symptoms did not appear for several years post-operation, in my case around 15. While I have been dealing with this for several years, I've recently reached stage 3 lymphedema, which has caused painful swelling in all affected areas, a burning sensation in my left leg, both of which have limited my ability to walk or even find a comfortable sitting position. It has reduced the oxygen supply to my soft tissue, has interfered with wound healing, and stimulated fat stem cells to grow, and has also provided a rich medium for bacterial growth, resulting in repeated antibiotic-resistant infections. So what will happen if I do not do anything? If it remains untreated, I will continue to get worse. I will soon lose the ability to walk altogether. My skin will start to harden and become like the skin of an elephant. I already have a few hardened areas of skin. I can be expected to develop skin ulcers and maybe even a rare form of soft tissue cancer. The lymph fluid will continue to build up, spread into soft tissue in other parts of the body until the lymphatic system vessels rupture, causing my death. So what can be done? At this point, I only have one option, and that is surgery, including microsurgery to reroute the lymphatic system by bypassing the damaged nodes and connecting the lymphatic channels directly into my veins. Or they can transfer healthy lymph nodes from unaffected parts of the body. After repairing the lymphatic system, doctors will use liposuction to remove the affected tissue and drain off the excess lymph fluid. Finally, doctors will perform what is called a Charles procedure, I believe, to remove the excess skin, using parts of it as skin grafts to repair the damaged and hardened skin. Sadly, my insurance will not cover most of the required procedures. They also won't cover travel expenses that may be required because there's a limited number of hospitals willing to treat me at this stage. So why help me? That's a very difficult question for me to answer. I've run out of options. This is life-threatening. And I'm seriously at the risk of ending up looking like Joseph Merrick, the man in the movie The Elephant Man. And I'll be completely serious. If it was just about me, I would continue to live with the pain and eventually give up. However, on January 4th, 2023, My life changed dramatically when my best friend, my kindred spirit, the most important person in my life, who I loved her and her daughter more than anything, died, making it a lot more important that I stay around. The moment I found out about her death, my life became about her daughter, who I have loved like my own. I need to be there for her. I need to be able to help her, advocate for her, and protect her. There are other people in my life that I need to be there for too. So I can't give up. I need to fight this. I need your help to do so. I need this surgery in order to free myself from this disease that threatens to turn me into a huge leathery tumor. Please do what you can do to help. I will continue to do what I can to help others on a daily basis. I know times are tight. So please give what you can. And please share this video.